Okay, it looks like we do have someone arriving shortly for a quick medical exam. Let's send them on in and have a nurse bring them by to the room. I do have all my medical equipment. It does look like I do have everything ready, so the room is perfectly set up. Okay, and hello there. Are you here for your medical exam? Perfect timing. Please do come in and get ready, okay? If you could just take a seat right at that medical chair in front of me. Could you please? Thank you. And just get cozy. I am Nurse Dreams. It's a pleasure to meet you here today. Yes, and I always let everyone who comes in know there is always a nurse exam that happens prior to the doctor seeing you. It's really fast, very quick. Some people even find it relaxing. But we always do this to make sure that there's not any other preliminary problems that we would need to know about before the doctor sees you, okay? Good, thank you for understanding. Now, how are you feeling today? Just a quick question. Not 100%? And what seems to be the problem here? On your report before you signed in and came into the room, it did say that you were having a bit of problem with your sleep. And what seems to be the problem? Are you on your phone too often? That's what I thought. A lot of screen time. How many hours per week? How many hours per day? Okay. And do you often sleep late into the night? Yeah. Your eyes are a bit irritated. I do see that. And lack of sleep can actually make it worse and make you feel worse, okay? I also see here that you may have a problem with your nose or your sinuses here. Is that true? Okay, we're going to check on that today and make sure that there's nothing else that's the matter, okay? Okay, so thank you so much for coming on in. Now I'm going to just first test your heart rate and get your vitals. Is that okay with you? Good. Now, this is often the icicle that this is, but we're just going to warm it up a little bit. I'm going to put this right on your chest if that's okay with you. Good. I'm going to ask you just to breathe in and breathe out. That's all. Okay, so let's just begin. Breathe in, breathe out. Good. Good. Other side. Breathe in, breathe out. Good. I'm going to test your back now just for your breathing. Breathe in and breathe out. Perfect. That sounds good to me. Now, I'm going to just quickly ask you a couple of questions while I do test your oxygen level. I always put this on your finger, so give me your finger. And just tilt your finger to the side because I do see your nails are beautiful and very long. Okay? Put that on there. I'm going to let that run. Now, while that waits, I'm just going to quickly check your eyes. Can you look at me? Good. Have you had any problems with your eyes in the past 2 weeks? Okay, do you wear contacts or glasses, or do you have any sort of eye prescriptions that you have? Perhaps different sets of frames for reading. Sometimes you can have glasses for long distance. Okay, can you look up for me? And look below. And let me know, is this to the left or the right of you? Good, and is that to the left or the right of you? Okay, I'm going to ask you to quickly follow the light, but don't move your head or your neck, because I do see that you're doing that, okay? Good, follow the light. Good, follow the light. Good. And what corner is this? Top left or top right? What about now top left or top right? What about now bottom left or bottom right? And what about now bottom left or bottom right? Really good. So I also do see that your eyes are properly dilating when I do shine the light inside of them. I do see that your eyes seem to be a bit tired, okay? And now what I'm going to quickly do is I'm going to get that oxygen level off of your finger, okay? Just see here what you're at. So it does say that your BPM is about resting 80, which is great. And your blood oxygen level is at a 98%. That's very good. Now what I'm going to quickly do is get your temperature, okay? Look at me. Okay. Okay, so we're looking at a very normal body temperature. And I'm going to write that down here. I'm going to test you one more time. Sit still. Okay, that's perfect. Just got to double check that. Okay, now what I'm quickly going to do is I'm going to just take a look right inside of your mouth. Okay, can you just open your mouth and say ah? Good. I'm gonna shine that there. I do see that the back of your throat is just a bit irritated. Do you have any allergens that you have? Perhaps pollen, maybe dust. Sometimes people get allergic to trees outside, especially if it is sunny. Okay, let's see that. I'm gonna actually write that down really quickly. Now I'm gonna write that down. Okay. And do you live in an area that's next to a lot of trees or next to a lot of plants? That can happen quite often. Okay. Good, just making sure, just double checking. You can close your mouth now. Now what I'm going to do is I'm actually going to take a look inside your nose. Some people find this a bit interesting, but trust me, it's something that we always do. And what I do first is I always apply a bit of a spray right at the nose. So look at me. Can I just apply a bit of the spray? Okay. And on this side. Okay. And then what I'm going to do now is take a look inside your nose. Just sit still. Okay. It looks like it's just a bit irritated on this side as well. Just a bit irritated in the nose. Okay. I think there might be something going on where you do look a bit irritated. I'm gonna write that down. And that can actually also be stopping you from having a really good night's sleep, so I'm gonna write that down here. What I'm gonna do is I'm actually gonna take a quick sample right from your mouth. Say ah, go ah. I'm gonna send that in. And then I'm gonna test right on your nose. Okay, and we're gonna test that for an allergen specimen, so thank you so much. Next, what I'm quickly going to do is I'm going to take a look inside your ears, okay? I'm just going to put an otoscope right inside your ear. Are you able to hear that? And have you had any problems with your hearing in the past 2 weeks? Okay, let's check the other side. And can you hear this? Any problems with hearing in the past 2 weeks on this side? Okay, I'm going to give you a quick hearing test. Let me know if you hear from your left to your right side. I'm going to put my hands next to your ears, okay? I'm just going to move my gloves, okay? And let me know if you hear this from the left or the right side. Left or right? Good. Left or right, 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 very good. I'm going to quickly just maneuver into your ear really carefully and just going to carefully just cleanse that, okay? Just going to use a little cotton around there. I'm going to cleanse that. The other side as well. Good. Didn't see any earwax, which is actually a very good sign. Your ears are super clean, which is really good to hear about. I'm going to ask you if you're able to hear this. I'm going to use a tuning fork. Let me know if you're able to hear it. Left or right. Can you hear that? Good. And is this on your left or your right side now? Left or your right side now? Very good. Looks like you're able to hear things super well, which is great. I'm going to ask you, kind of a funny thing here, I'm going to ask you to blow into this, and I'm going to just test the pressure of your lungs, okay? So 3, 2, 1, and 3, 2, 1. Okay, it looks like we're at 80 psi, which is amazing. Lung ability is perfect. I'm going to quickly test your muscles now. We're going to do just a quick test to see how your reflexes are, okay? So first give me your arms. Good. Reflex is good. Give me your arm here. Reflex is good. Give me your hand. Good. And give me your other hand. Good. Okay, and I'm going to ask you, can you just shake my hand, but shake my hand as tight as you possibly can. It's not going to hurt me. Good. And over here, shake my hand as tight as you possibly can. Good. Very good. Let's test your knees. Try not to kick me. Okay, let's test it. Good reflex and great reflex. That's looking great. Now I'm just going to give you a quick spatial awareness test, okay? Now I want you to let me know which hand is closer to you. Good. 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 Okay, how many fingers am I holding up? Good. And how many fingers am I holding up now? Perfect. Now how many fingers am I holding up now? Good. And how many fingers am I holding up now? Perfect. How many fingers am I holding up now? And how many fingers am I holding up now? Good. And how many fingers am I holding up total? Very good. The last one was 10. Okay, I'm going to quickly ask you, what date is it? Okay, and what time is it? Okay, and how do you spell your first name? And how do you spell your last name? And what is your birthday? Good. Now, I always ask people this just to make sure that we're thinking of the same date, the same time, that we're having the same medical date and time as well. Okay, and right before the doctor does see you, I do have to get a little sample from your eyes, so if you could please close your eyes. Thank you so much. Just going to take a sample. Okay, can you open yours a little bit? Perfect. Okay, I'm going to send a sample in, and then in one day, I'm going to let you know the results by calling you on the phone, and then we're also going to send you an email, okay? And then what we're going to do is I'm going to have the doctor come and check in on you now. We're going to make sure that your health is number one and top priority, okay? So stop using your phone so late at night. That's always number one. Remember that your sleep and your wellness is always better than anything you can find online or just watching television, etc. So have yourself a good rest of your night, and the doctor will see you right now, very shortly. Thank you so much for coming on, being here. Have yourself a good night.